I'm Trevor Strom with the Winnipeg Regional Health Authority Emergency Program, and my title is Informatics and Process Improvement Lead. First of all, I have to say that being a Canadian Healthcare Analytics Conference is really outstanding. Being able to talk about healthcare analytics, the technology, the issues that people are facing, all within a Canadian context, is second to none. This is really one of the best analytics conferences I've attended because of the Canadian content and because of the people that we meet at this conference. We've met people from, InfoA, from Canada Health, Canadian Institute for Health Information, and just a really outstanding selection of delegates were here.
I'm David Henry. I'm a professor at the University of Toronto, and until recently I was CEO of the Institute for Clinical Evaluative Sciences, otherwise known as ISIS. We hold most of the population data for Ontario, the healthcare system data, the population data, vital statistics, all of it linked at the level of the individual, which allows us to do a wide range of studies with both policy relevance and health relevance. The challenges actually are not in the data. The data, I think, are quite good. There are gaps. We don't have drug data for people under the age of 65. We don't at the moment have good electronic health records. We're relying on administrative data. But the big problem, I think, is the unresponsiveness of the healthcare system itself. It's heavily siloed in Canada, particularly Ontario. It's too hospital dominated. There isn't enough primary care, good quality primary care, not enough population health. And I think the data indicate those deficiencies. And I think for that reason, Canada is beginning to lag behind other countries and should be doing better than it is. So the data tell us what to do, but they also tell us when the country's lagging, and it is on a number of fronts.
Jason Lewis. I'm with the Regional Paramedic Program of Eastern Ontario. We're responsible for the certification, education, and the quality of the paramedics in Eastern Ontario. It's great. This is my second year here. Enjoyed last year. It's great this year. It's nice to have a couple hundred people in the same room speaking the same language. As nerdy or geeky as it may sound, it's not the most. Doesn't exactly get you jumping up and down with the topics, but we're all kind of in the same boat and all dealing with the same issues. We're all dealing with issues of good, clean data, the amount of data that we have, and just moving in a direction. It seems to be everybody's doing the same thing, all in that infancy stage of where we need to go.
Hi, Debbie Schmidt from St. Joe's Healthcare Hamilton, and I'm a clinical informatics nurse. Excellent. The speaker this morning actually was exceptional. He made it very interesting and fun to listen to as well.
My name's Alex Mayer. I'm a director of architecture at Canada Health InfoA. I think some of the challenges that organizations are needing to deal with is they really need to start thinking about new ways that they can mine their existing data. I think we've had a lot of this data for many years, and we really need to start thinking out of the box about what we can do in getting value out of data, whether that's open data concepts, whether that's predictive mining of data that we have, or whether that's linking existing data sets together to create a better view of the patient and the services that we provide that patient.